This video is an overview of the Midmark digital vital signs device operation. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. Blood pressure. Blood pressure measurements obtained using this device are similar to those obtained by a trained observer using the cuff and stethoscope auscultation method or other approved electronic and automated sphygmomanometers. There are 4 pressure setting buttons to choose from. These can be preset to pressure settings of the user's choice. See Section 9B in the Midmark Digital Vital Signs Device Operation Manual for detailed information on changing pressure settings. Blood pressure cuff selection. Using the proper size blood pressure cuff is important for accurate blood pressure readings. Midmark recommends using Midmark or UltraCheck reusable cuffs with the Midmark Digital Vital Signs device. Cuffs that are too small may result in erroneously high blood pressure readings. Cuffs that are too large may result in erroneously low blood pressure readings. To verify the proper cuff size for a patient, wrap the cuff around the patient's extremity. The index line, or white arrow, should fall within the white range markings on the cuff. If a patient falls between 2 cuff sizes, always use the larger cuff. Positioning and applying the blood pressure cuff. The preferred measurement site for adults and children is the upper arm. Other sites that can be used are the forearm, thigh, or calf at the ankle. Do not wrap a cuff over a patient's clothing. Inaccuracies can occur. Be aware that there may also be a difference between readings taken on the left side versus the right side. The cuff should be positioned level with the patient's heart. Measurements taken with a cuff placed above heart level can result in lower blood pressure readings. Measurements taken with a cuff placed below heart level can result in higher blood pressure readings. Place the cuff brachial artery marker over or close to the brachial artery when the cuff is applied to the upper arm. For best results, wrap the cuff snugly so that there is room for no more than 2 fingers under the cuff. Initiating a blood pressure measurement. Start the Midmark Digital Vital Signs device by pressing the gray on and off button on the front of the device. From the main testing screen, place the properly sized and positioned blood pressure cuff on the patient. To start the blood pressure measurement, press the appropriate blood pressure inflation rate button on the main testing screen. Ideally, the initial inflation cuff pressure should be about 30 milligrams of mercury above the patient's systolic pressure. Using a higher inflation pressure may cause the patient unnecessary discomfort. Choosing an inflation pressure that is too low may cause the device to re-inflate the cuff in order to obtain a systolic pressure reading. When a blood pressure measurement is started, the stop button will be highlighted. To stop a blood pressure measurement at any time, press stop. When the measurement is stopped, the cuff will deflate and all buttons will be enabled. While the blood pressure measurement is running, the in progress wheel will appear along with a message that reads, "Please relax your arm. Blood pressure in progress." During a blood pressure or any other measurement, the clear button is disabled. When the blood pressure measurement is complete, the systolic and diastolic values appear on the screen. A pulse rate will be displayed when a blood pressure measurement is complete. The pulse rate will appear below pulse rate on the screen. The clear button will be enabled when the measurement is complete. Temporal temperature. The Midmark Digital Vital Signs device provides a connection to the Exergen temporal scanner for non-invasive temperature measurements. The temporal scanner is an infrared thermometer designed for accurate, completely non-invasive temperature assessment by scanning the temporal artery. For adult temperature measurement, place the probe flush on the center of the forehead and depress the button. Keeping the button depressed. Slowly slide the probe midline across the forehead to the hairline. Keeping the button depressed, lift the probe from the forehead. Touch behind the ear halfway down the mastoid process and slide down to the soft depression behind the earlobe. Release the button, remove from the head, and read. To use the disposable caps, apply the cap by pushing it onto the probe cone with the fingers. Remove the cap by pushing the top edge of the cap forward with the thumb. Caps may be reused on the same patient. Pulse oximetry (SpO2) operation. Each Midmark Digital Vital Signs device with SpO2 is shipped with 1 reusable adult SpO2 finger clip sensor. Carefully read the sensor directions before using. To perform the SpO2 measurement, insert the patient's finger completely into the sensor. Place the sensor with the LED light position on the fingernail. If patient movement is occurring or the finger size is inappropriate, select a different sensor that is appropriate for the patient. The thumb should not be used with the finger clip sensor. If the blood pressure measurement is occurring simultaneously, place the finger clip sensor on the limb opposite the one with the blood pressure cuff. Avoid using the sensor with dark nail polish or direct sunlight on the probe, as these conditions may result in inaccurate readings. When the SpO2 sensor is attached to a patient's finger, an audible tone will sound and the in-progress wheel will appear on the vital signs device screen. When the SpO2 measurement is complete, an audible tone will sound and the SpO2 value will appear. The SpO2 value continues to update as long as the sensor is on the patient's finger. Should a measurement time exceed 10 minutes for one patient, error code 312 will be displayed alerting the user that the SpO2 measurement has exceeded the 10-minute time limit. Scale operation. A Fairbanks Tellaway digital scale can be used for collecting patient weight. When the scale is connected to the Midmark digital vital signs device, the device will automatically detect the scale has been connected and is ready for use. The scale will automatically transfer the weight measurement to the Midmark digital vital signs device. A Midmark exam chair with the integrated digital scale can be used for collecting patient weight. When the Midmark digital vital signs device is configured with the integrated digital scale, the table scale icon button will appear to the right of the clear button on the Midmark digital vital signs device main testing screen. From the main testing screen, press either the weight button or the table scale button. The Midmark exam chair screen will appear. When the zero scale button is pressed, the button will display the in-progress wheel until the scale is zeroed. Once the scale is zeroed, a scale-ready message will appear and a weight button becomes active indicating the option to take a weight measurement is available. When the weight button is pressed, the chair will move to ensure that the patient's feet are off the floor. The in-progress wheel will appear during weight acquisition. The weight data will appear on the screen once the weighing process is complete. Units are displayed based on the user settings in either kilograms or pounds, and 2 decimal points are shown for both kilograms and pounds. After weight acquisition, the Save button becomes active indicating the option to save the weight is available. Weight can be otherwise determined and entered manually using the keypad on the display. If the Close button is pressed after acquiring the weight, a warning message will appear that reads, "Are you sure you want to close without saving weight?" Press Yes to close the message and return to the main testing screen. Manual entry of data. Weight, respiration rate, height, and pain score can be entered manually by pressing each corresponding button on the main testing screen. If a manual entry falls outside the range, an error message will appear, prompting for entry of a score within the range. Pain score. When the button underneath the pain score label is selected, the pain score screen will appear. If a pain score has already been selected, it will be highlighted. Otherwise, none of the pain scores will be highlighted. Select the appropriate pain score by pressing the corresponding number on the screen. Press Save to transfer the new pain score to the patient record and return to the main testing screen. Press Close to disregard any changes and return to the main testing screen. For more detailed information about setting up your device, please refer to the Midmark Digital Vital Signs Device Operation Manual. For further support, contact Midmark Technical Support at 1-844-856-1230, Option 2.